Welcome to the Nursing Post podcast, all nursing all the time with Ashley Moore and Rosa Horsley. Since the start of winter is just around the corner, we thought it would be a good time to talk about seasonal depression. Our goal is always to inform and start conversation.
Seasonal affective disorder affects about 10 million Americans. Seasonal affective disorder is also known as SAD, is a type of recurrent major depressive disorder where episodes of depression take place during the same season each year. This is also referred to as the winter blues because the most common seasonal pattern is for depressive episodes to actually appear in the fall or the winter, and they diminish by spring. SAD can occur during the summer months, but it is less common. If someone has SAD during the summer, it usually starts in late spring and then it goes away by the fall.
That's interesting. Here we go with our numbers. 10 to 20% of patients have mild SAD. SAD is 4 times more common in women than in men. Average age of onset is between 18 and 30 years old. 6% of patients require hospitalization. People with SAD report at least one close relative with a psychiatric disorder, 55% with severe depressive disorder, and 34% with alcohol abuse. People are self-medicating.
Yes, absolutely. Yeah. There are some symptoms and causes that we're going to go over. For the symptoms, we've clustered them together to be just kind of generic for the seasonal affective disorder, and then more specific ones for summer versus winter.
Awesome.
So in general, a feeling of depression most of the day or nearly every day, losing interest in activities that you once enjoyed, low energy levels, problem sleeping, having changes in your appetite or weight, feeling sluggish or agitated, difficulty concentrating, feeling hopeless or worthless or guilty, having frequent thoughts of death or suicide. And to me, those are just your normal depression symptoms.
Yeah.
There was nothing that stuck out for me in that. Specifically for winter onset, oversleeping, changes in appetite, and this is actually specific for foods that you crave that are high in carbohydrates. Weight gain, which if you're eating foods that are high in carbohydrates, that kind of makes sense. Yeah. And fatigue or low energy. For summer specific symptoms, for seasonal affective disorder, you have insomnia, poor appetite, weight loss, and agitation or anxiety.
Heat can make you agitated. Just saying. Yeah. If you're hot, it can make you angry. So the exact cause of seasonal affective disorder is unknown. There are a couple of factors that researchers think play a role in SAD. First, this idea is that people with SAD may have an imbalance in serotonin. Serotonin is a brain chemical that affects the entire body, but most importantly, it stabilizes our mood, feelings of well-being, and happiness. Researchers also believe that the body makes too much melatonin, a hormone that regulates sleep. Lastly, the third piece is not enough vitamin D, which during the winter months, we do have less sunlight, so lack of sunlight exposure. This is why persons who live farther away from the equator tend to be affected more by SAD.
So diagnosis and treatment options. For diagnosis, this is very similar to any kind of diagnosis that you would get for depression. It can be difficult to diagnose seasonal affective disorder just because it's so similar to other mental health conditions. But of course, you would go to a physician or a provider. They would do a physical exam. They can look for links to depression. So if you have a lot of chronic illnesses like diabetes, heart disease, arthritis, kidney disease, HIV or AIDS, lupus, MS, all those things that are kind of chronic debilitating diseases or can be chronic debilitating diseases can cause depression. So your physical exam will make sure that you don't have any of those that's, causing you to be depressed. And hypothyroidism specifically can also lead to depressed feelings. So fixing that specifically can fix the problem. They'll do lab tests like a CBC. You can check for anemia that can make you feel very tired and fatigued.
Absolutely.
And also a thyroid panel to check for hypothyroidism are a couple of the labs. Those are a couple of the labs that they'll do. Psychological evaluation that would need to be done that will analyze thoughts, feelings, and behavior patterns. And there's something called the DSM-5. It's the Diagnostic and Statistical Manual of Mental Disorders. It's been published by the American Psychiatric Association. And this manual is for assessment and diagnosis of mental disorders. It is not for any kind of treatment. It doesn't have guidelines. It's specifically, does the patient meet these parameters? If so, then this is the diagnosis. It's for diagnostic purposes only.
Yeah, I think we've talked about this testing in a previous episode.
Okay.
So there are some other treatment options, like light therapy is one of the first line treatments for fall onset of SAD. It typically starts working in a few days to a few weeks and causes few side effects. Light therapy mimics natural outdoor light and appears to cause a change in the brain chemicals linked to mood. Research on light therapy is limited, but it appears to be more effective for most people in relieving SAD symptoms. You do want to talk with your prescriber before starting light therapy, since there are many options. Also, if you have bipolar, light therapy can potentially trigger a manic episode, which, when you think about it, hindsight being 2020, I can see where that makes sense.
Right. I didn't think about that being an issue really at all, just because for this light therapy, you want increase those good hormones. And that's the whole point, is to be outside and getting the sunlight, but you're not, because it's, winter. And I mean, like, it's dark here very early now where we're at. And if you're not up earlier in the morning, you're missing out on that sunlight if you're not outside in it.
Absolutely.
So to think that would cause manic episode, it made me a little bit curious, just because I figured that it would be helpful. But I guess if
you don't turn it off,
there's too much of a switch too quickly for for people who have bipolar. That's what you're trying to avoid, is that sudden
You're not
change.
trying to keep them stimulated,
right?
I did find this interesting because I do shop online a lot. This therapy is not really expensive at all. If you take a look, light therapy, I mean, it ranges. I think I'm looking online now and I see some just starting at $30 or $21.
Right. And I think that they say, like, you want to start at like a 10,000 lux unit. From what I read, I didn't keep note of it, just because it's not something that I'm not a prescriber, so. No,
but it's definitely something that if you're a patient,
it's very affordable, and it's literally sitting in front of this light for 20 to 30 minutes. I think some people have to sit into it like up for 45 minutes, but I mean, you could do that while you're getting ready, drinking your coffee. There's options.
Reading, a lot of things, watching TV, and whatever.
Me personally, the type of person I am, I'd rather do that than take a medication. I'm the same way. It was shown to be about 80% effective for most patients with seasonal affective disorder.
I think that's amazing.
It's huge, especially because there's not a lot of research on it. We just know it works. There are antidepressants that you can take for seasonal affective disorder. And this happens, of course, if you have severe symptoms. So there are SSRIs, or selective serotonin reuptake inhibitors. They are the most commonly used antidepressant for treatment of SAD. There is also an extended release version of the antidepressant bupropion, and this is helpful to prevent depressive episodes in patients who have a history of seasonal affective disorder. So what you would do is you would start taking this at a predetermined time before winter came. So if you know that typically, I don't know, let's say the middle of December, you start having issues, you would start taking it a few weeks before then. And then you would take it through the season until a few weeks after, where you typically have depressive episodes, and you would take it for that time. And it would hopefully be preventative. So I thought that was very, very interesting. And it's particularly that particular one medicine. And bupropion is a norepinephrine dopamine reuptake inhibitor, or an NDRI. So that's the specific class for the bupropion.
There's also psychotherapy. That's the ability to talk with a therapist. Yeah. I mean, it's exactly what it sounds like.
Talk therapy.
And it's another option to treat SAD. I think it's an option to treat a lot of things, not just SAD, but
really
depression, anxiety, and other things. So in this type of psychotherapy, known as cognitive behavioral therapy, which is CBT, can help. And I know we've talked about it a little bit in some other episodes relating to some other disorders, but it does help identify and change negative thoughts and behaviors that may be making you feel worse. You can learn healthy ways to cope with SAD, especially with reducing avoidance behaviors and scheduling activities. And it teaches you how to learn to manage stress. So I don't know if 2020 has been for you what it has been for me, but I may be able to need some help there on managing that stress.
Absolutely. And I have a feeling that seasonal affective disorder is going to be worse this year than it's been in a while.
And, you know, I do have to say this. Psychotherapy, seriously, sometimes just talking to your friend. Like it doesn't, you know, somebody who's willing to listen and just give you an ear. That can be helpful.
Sometimes you don't need somebody to give you advice. You just need somebody to listen.
Get it off your chest and vent.
Absolutely. There is a mind-body connection therapy that you could try. And this would be relaxation techniques like yoga or Tai Chi. You could meditate, use guided imagery. And guided imagery is when you're like listening to something and you're thinking through, you're imagining what they're trying to describe to you. And then music and art. We know that music and art use a different part of the brain. So it's just different. You don't have to be good at it.
It's perception. It's one of those things, you know. I love music. It is my therapy.
Right.
Like, it's just my therapy.
I say you can't sing. You might sing fine.
No, I can't sing.
I wasn't going to throw it out there like that.
I can't sing well, let me tell you.
But listening to music can be very therapeutic for you.
Absolutely.
We have a friend. If we told her she couldn't listen to music, she'd be done.
Yes, she would be done.
And look, I don't even have to say who it is. You know exactly who I'm talking about.
I know you do.
And it's just, it is her therapy. It's part of her therapy. And some people, you know, when you talk about art, I can't.
You're not into it?
No, like I shouldn't say I don't appreciate it, but I look at a painting, I'm like, it's really nice, but I don't automatically see the hours that somebody's poured into it. It's a
You're
thought
not looking
process.
at brush strokes and seeing how the paints come. I do.
It's good or it's not, you know, and that's fine. But I'm going to tell you, you want me to babysit your child and we sit down with a coloring book. I'm not thinking about anything except for that little coloring book, which sounds so simple. But it really will take my mind off of I'm focused on coloring in the coloring book. So it sounds so simple, but I mean, I know that I've sat down and colored with a child before and been like, well, that was just a thoughtless activity. And at the end, that child did not even care if I did a good job or colored in the lines.
He didn't care if you stayed in the lines. He didn't care if you mixed that red and blue and made purple.
That was ombre. I did that on purpose.
But I mean, we do have, it's funny when you say that because, you know, it's not only children's coloring books now that are out there. They're very adult, you know, you have to concentrate and precise and color by number and the whole 9 yards. And
there's a reason for that.
Yeah, it's
because
soothing.
It really helps people to do that. And so it sounds silly. Like if you really are having a hard time where you just can't turn your mind off, get a coloring book. I'm going to tell you right now. You're like, where's the pink? Where's the pink? I can't find the pink.
Oh man.
All you'll be worried about.
Like, shoot, I went out of the lines. But music always helps.
Get you some erasable color pencils.
So this year, seasonal affective disorder, like Ashley said, is probably going to be worse. Listen, we're going through a pandemic. We're coming off the heels of a very, I think, unexpected election. So we were already stressed coming into 2020.
Absolutely.
And depression is worldwide. It's not just the United States. Sometimes I kind of bubble. I feel like I'm in a bubble.
Right. Well, it's what we know.
Yeah, it's your everyday life, and if you're not consistently thinking about it, you kind of sometimes miss the bigger picture.
Right.
And we're not the only ones that exist in the world. So, with many around the world already experiencing some level of depression from the helplessness and confinement, like I mentioned, from the pandemic and our electoral process this year, you know, seasonal depression is only adding yet another layer. And there are many avenues to get help for depression. So if you're feeling depressed, please reach out for help.
Absolutely.
Whether it's family, your provider, please reach out for help.
Without a doubt. As always, we will link our references to our website, thenursingpostpodcast.com. Please join the conversation and leave your comments on our social media platforms or on our website. Please subscribe to our podcast. Thanks again for listening to The Nursing Post.